COVID-19 is crippling the province of Ontario. It broke another record again today, recording more than 2,200 new infections. And now we've learned that the province wants hospitals in the hard-hit regions to clear beds within 48 hours to be ready for a surge of cases. A memo went out asking hospital CEOs in gray and red regions to ensure that they can handle a 10 to 15% surge. Hospitals in green, yellow, and orange zones are asked to plan immediately to be able to do the same. A spokesperson for Ontario's Ministry of Health says the situation in hospitals is a reflection of community spread of COVID-19. Let's bring in CTV News infectious disease specialist Dr. Abdu Sharkawy joins us now from Toronto. Dr. Sharkawy, let's talk about this memo. Has this kind of memo gone out before? Have hospitals been asked to prepare this way?
Well, this specific memo hasn't gone out recently, but this is a situation that most hospitals are prepared to. There are exceptional circumstances that occur not infrequently that would require increasing our capacity and trying to have people safely discharged from hospital if possible. That being said, I think we're in a unique situation right now where we are seeing record high numbers of COVID-19 across the province. And we saw that today with fewer tests than we've done in a while. And we see stress points happening in many regions, particularly Brampton and Scarborough, that have been transferring their patients to other facilities because they've been in distress. 50% of the ICU patients in Scarborough are COVID positive. So this is a trend that is certainly getting worse. It will get a lot worse before it gets any better. And we all have to be prepared to make sure that we can deal with it as safely as possible so that no one is left behind who doesn't have to be.
So what are the options for the hospitals? You mentioned, for example, one facility transferring patients to a different facility to ease the load, or discharging patients if they can. What are the other options for them to make some room?
Well, one of the major problems we have with acute care hospitals is, unfortunately, many patients are waiting to be transitioned to the community, and it takes time for those resources to be set up for things like wound care and extra levels of support at home. We're going to have to push that envelope. So those patients will probably have to go home a little sooner than they might under regular circumstances. That's going to create extra pressure on our community resource network to do so. If that can't make up the deficit on its own, we do have a surge capacity that exists for up to 115%. That's within our critical care units. That means that beds could be freed up in other parts of the hospital and people deployed from other areas to help with respect to critically ill patients. That's something that we don't want to see happening anytime soon, but we're all preparing for that inevitability, and that could happen any day now over the next week or two.
So the hospital you work at, have you seen a steady increase, or what's the situation there?
We're certainly seeing a trend. I myself admitted 2 COVID positive patients just in the last 24 hours. We're seeing hints that people are going to be trickling in and in the ICU as well. And our COVID unit, which has been closed here at Toronto Western Hospital for the past month, we've been decanting over to Toronto General, our sister hospital. Our unit's probably going to open up proper at some point later this week because we are seeing the numbers go up on a daily basis.
Can you tell me a little bit more about the ripple effect something like this has when a memo goes out and hospitals have to prepare this way?
Yeah, I mean, I think we have to be cognizant of the fact that this is not only a moment where we have to brace ourselves and be prepared to mobilize whatever resources we need to as part of the healthcare force, but also it's important for patients to understand that it doesn't mean that we're closed for business. And it's very important for people to understand that hospitals are still a safe environment for both COVID and non-COVID related issues. We want people to come to the emergency room if they have issues with their heart or lung or cancer or any other chronic condition. We don't want people to get the impression that hospitals are not capable of caring for them. We saw that in the first wave, and a lot of people ended up coming into the hospital later when they were a lot sicker than they needed to be. And we can ill afford to let that happen again. That would be tragic.
Dr. Sharkawy, appreciate you joining us for this. Thank you for your time tonight.
Thank you, Mirella. Stay safe.